Hello and welcome to all of our Gold viewers who are here with us today. I'm Kristen Schwartz, licensed midwife and one of the MCs here at Gold. And here at Gold, we're getting ready for our big lactation conference of 2024. And with me here today is one of our speakers, Dr. Shacchee Khare Baweja. Welcome, Shacchee. It's wonderful to have you here.
Thank you, Kirsten. It's wonderful to be here. I'm very excited.
You have a wonderful presentation planned for us, an interactive presentation where our viewers really feel like they are participating and being part of the action, right? And the title is Fostering Bodily Autonomy in Lactation, Breastfeeding Support Through the Lens of Parental and Infant Rights. That's absolutely beautiful. I want to hop into that in just a moment. I just want to ask you briefly, you are an pediatrician, an IBCLC in India. So briefly talk to us, and you're in a very busy clinic. Tell us a little
Mhm.
bit just briefly about your work.
Right. So I work in a tertiary care hospital where I am responsible for all things lactation. So I'm involved with one-to-one lactation support to the diets and also training of the healthcare staff. So I have a team of 7 beautiful people who are round the clock available to support new parents in their lactation journey. So right from the OT recovery till the time they get discharged, we are hand holding them and providing them support, whatever they need. So day one, we are giving them hands-on support. Day two, we are helping them discover things for themselves. And on discharge, they get a care plan, which is made in collaboration with them, giving them choices, understanding what their goals are, and then making a plan for them. So that is what essentially my work in hospital is. And I also have private practice wherein in my clinics, I get again families where I provide one-on-one lactation support.
Beautiful. So you give them care plans,
Yeah.
you're really giving them a good start for their breastfeeding journey, right? So the topic, I'm really, really excited about this topic, fostering bodily autonomy in lactation, right? That's your
Yeah.
topic. So first of all, let's talk about that. What does it even mean, bodily autonomy? What does that mean in the
Right.
context of lactation?
Right. So in very, very simple sense, if I say the power to say yes and the right to say no, I have read this quote somewhere and it really like struck a chord because
Yeah.
so many times when we are talking about nursing, breastfeeding, lactation, all the recommendations, all the public health messages, they always talk about that it should be done, it should be done. But if we really look at it from the parent's perspective, if it is something that is easily achievable for them, if it is something where they have troubleshooting options, the right kind of skilled support, they are wanting to do it and they are able to do it. But if a parent has some challenges, right, from whatever their past lived experiences are, or if they are not getting support in the current context, it's very difficult for them to continue. And on top of that, when they hear narratives like, oh, if you don't, the risk based language, if you don't
Mm,
breastfeed, this
right.
is going to happen, the risks are higher. So I feel when a parent is already struggling and they hear this all risk factors and all that, it stresses them out even more. And as lactation professionals, who better than us to understand the role of oxytocin in
Yes.
in 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 lactation? So when we are stressing them out so much, one, they take non-autonomous decisions. They take decisions based on fear, based out of fear. They are kind of pushed into that decision. So if we can provide that kind of support where they are able to take decisions based on what their capability is, what their circumstances are, I have seen that more often than not, the chances of whatever their definition of success is, that's more. So it helps in preventing trauma to the parents. That is
You,
what it means to me.
oh, you worded that so beautiful, Shachi. That really is. It is really not a journey of you should, you must, but really taking agency for the parents taking agency and
Yes.
really feeling they are in
Yes.
control of it. They are, saying yes. And are so much so much more easy for them to succeed, right? Than
Yeah.
if acting out of fear.
Yeah.
Um, Now let's also talk about the baby. The baby is so important, the infant, right? So
Mhm.
let's talk about the importance of respecting the infant rights. That's something in your title as well.
Yeah.
And so talk a little bit about that.
Yeah, so again, when we talk about lactation, specifically when we see these public health messages, so the major thing or the major debate is, okay, you are agreeing to a parent saying, I do not want to breastfeed, but what about the baby's right? Right,
Hmm.
I totally get it, and there is no denying the benefit of human milk for human babies. But we are not looking at whether the parent is able to breastfeed right now when they are with us. We are also looking at when they're going home with their baby. So, a parent who's mentally healthy, who's non-traumatized, who's not stressed will be any day a better caregiver for their baby, would be a better provider for whatever nourishment the baby needs in a better sense, as opposed to a parent who's highly stressed, who's so hyper vigilant and anxious that all their decision is based on fear and anxiety rather than carefully thought of care plans. Because whatever we do, when we are pushed, or whatever decisions are non-autonomous, they are usually not sustainable.
Mm. Ah, such a good point. Yes,
Yeah.
absolutely. Absolutely true. That not sustainable. Absolutely. Now, let me ask you about this. You are practicing in India. You know, our lactation care providers, IBCLCs, who are watching this are all around the world, right? Yeah, we're an
Yeah.
international place of learning here. So, what do you think cultural beliefs and societal norms influence the
Yeah.
perception of bodily autonomy?
Yes. That's actually a very good question, and I'm glad you asked me, because so many times we talk about equity, so many times we talk about respecting other cultures. But see, cultural humility and cultural competence are two different things. And I would really like to put this point across, that even when we know other cultures, cultural competence comes from understanding, and then whatever their cultural beliefs are, taking them into consideration when forming care plans. For example, in certain countries where family plays a big role, the family who surrounds the diet, yeah, the nursing diet. So if in our care plans that dynamics is not respected, in all probability, again, that won't be a sustainable plan. So, cultural humility is respecting the differences that might be in the providers as well as the clients' cultures, and then making collaborative care plans.
Love that. Yeah, cultural humility and respecting the culture of the family where they're at and meeting them where they are. Absolutely love this. Oh, there is so much to talk about, Shacchee. I can't wait for your presentation here. Before I let you go, I would really, really like you to give us a little overview what you're hoping our viewers will learn, and maybe a little nugget of wisdom from your side.
Right. So, what we see, like anyone who has been working with breastfeeding diets, nursing diets for some time would have surely observed that parents are always able to take like greater part in infant feeding decisions, exercise greater autonomy if the relationship with their provider is of someone who is knowledgeable but who is at same level as I, who's getting the support. So there is a thing called power dynamics. So whenever you have someone as a client who has come to take your help, there is always a power dynamics going on. So whenever the provider who's at a higher place of power, who has the power privilege, whenever they intentionally try to overcome this barrier. It can be as simple as coming and talking at the eye level, sitting with the family rather than standing at a higher level, to being very non-judgmental intentionally, to being so open both in body language as well as verbal language that family feels really comfortable discussing all their thoughts, rather than feeling, oh, if I talk about this, I might be like, they might give me a, oh, no, no, you cannot do that. So being open in terms of having, being able to accept all the ideas without sounding critical or judgmental in any way, and still being able to put across real skills and knowledge. That is something that helps in better care plans, and that mostly comes when we are respecting that person's individuality, their past lived experiences, and their current circumstances. When we take all this together and then sit and make the care plan together, we usually get more sustainable care plans, and as a result, better success rate for the family, which is like the biggest thing for someone.
Thank you so very much, Shacchee, for being here with me, talking about your presentation. And of course, we are all looking forward to seeing you at the conference. Thank you so much for being here with me today.
Thank you so much, Kirsten.
And for all our viewers, if you have enjoyed this topic and listening to Shacchee here, we hope you're joining us at the Gold Lactation Online Conference 2024. You can find out more information at goldlactation.com. We are getting started on April 2nd with our free open access keynote presentation. You can find the information on the website as well. Make sure you share that information with your friends and colleagues in the field. And I hope to see everyone at the conference. Bye-bye, everyone.